So right now we have Dr. Sean Granis joining us from the Regenstrief Institute. He is the Vice President of Data and Analytics. We're going to be talking about what's called the Data Dashboard. So Dr. Granis, what is the Data Dashboard? How does it work and how does it relate to the coronavirus?
Sure. So the Data Dashboard is a collaboration among a number of organizations that traffic in healthcare data: the Indiana Health Information Exchange, the Regenstrief Institute, the Indiana State Department of Health, the Management Performance Hub, have all come together to integrate data into a common location, into a common format, so that people can get a better sense of situational awareness around coronavirus. So we are capturing data points such as hospitalizations, emergency department visits, laboratory test results, both positive and negative. We're also looking at mortality statistics among patients who are hospitalized, and we're calculating recovery metrics. In addition to that, one of the features that we find most popular about the dashboard is the trending section. So we've developed an area where individuals at a glance can take a look at various regions, whether county, statewide, or at the public health district level, to understand whether counts are trending up, down, or staying about the same.
So you talk about a number of partners that you have here, and one of them, of course, is the Indiana State Department of Health. And so this is a complementary collaboration, and it is not separate. So what sort of things have you added in terms of the data dashboard to the Indiana State Department of Health?
Sure. So yeah, it very much is a complementary and collaborative effort. So on the Regenstrief Public Dashboard, we actually refer people to the state's dashboard for testing and mortality statistics. And then the state's dashboard refers back to ours regarding more of those clinical metrics, such as emergency department visit data, hospitalization, admission, and discharge rates. So we, on the public dashboard, we are really tracking the clinical journey of patients who test positive with COVID. So you can see when a person visits the emergency department, we have those counts. We can see when patients are hitting the hospital for admission, when they're testing positive, when they're discharged. So all of that information is information that we are tracking to monitor the impact of COVID.
Okay. So we have this information available across hospitals, in hospitals across the state, at the county, regional, and county, and state as a whole. So the public also has access to the information. Is that correct?
That is correct. Yes, they can go to the regenstrief.org website and they'll see a link directly to that dashboard to access that information. One of our perspectives at the Institute is we want people to have the best information possible to make informed decisions. Like most things in life, we do not have perfect information. Unfortunately, with coronavirus, we still are learning a lot, but we feel that providing this type of information helps to create an informed population who can make wiser decisions regarding their own response to the coronavirus.
And how do we get people to understand the importance of knowing this information? We know it's available, but how do we get them to understand knowing the importance of it?
Sure. So I think there are many reasons why it is important, and that ranges from understanding the degree of disease in the community. So right now we are seeing an upturn in the test positive rate. So we believe that the prevalence is growing. So that should help people understand that they should, as always, follow the precautions that are being recommended, including social distancing, including wearing face masks, including hygiene. So the data gives us a sense of what's happening there. I think it also can provide a level of reassurance to understand that there is a great deal of transparency surrounding data and information for coronavirus. I think there can be a lot of fear and uncertainty about this virus. I think Indiana is one of the best connected and most transparent states in the nation with respect to coronavirus. We receive a significant amount of support from the state to make sure that this data is readily available to the public. And so better knowledge leads to better decisions. And that's really at the foundation of why we're providing this information.
So this information is very, very sensitive information. Do you worry about information hackers? And if so, what are you doing about this?
Sure, absolutely. We take data security and privacy very seriously. So the information provided on this dashboard is not identifiable. Individual persons cannot be identified. And in fact, if we think there's any risk of any subpopulation, we will actually censor that data. What that means is while we have the information, we will not present it to maintain privacy. So privacy and security are the utmost priority for us. In fact, individuals at the Regenstrief Institute, including myself as well as others, actually work on national policies and strategies for protecting and keeping patient data safe and private, because we value our privacy and security as well.
We've seen hospital beds or the states across the country are increasing their hospital bed capacity. So a county in California is at 99% capacity. We talked about transparency and having this knowledge. Do you see Indiana getting to that point?
Getting to the point of reaching capacity, is that your question?
Correct.
Yes. Well, at this stage, we are not there. Predicting the future is hard, particularly with coronavirus. I think to the extent that we continue to follow the mitigation measures, social distancing, mask wearing, good hand hygiene, I think that will be our best approach to preventing us from approaching that. Again, good news is right now we're nowhere near that capacity, and I think Hoosiers have proven the ability to respond to coronavirus in appropriate ways. We flattened the curve when we needed to flatten the curve, and I think we have that capability to titrate or throttle this epidemic.
And last question for you. What would you like to tell the people of Indiana? Final thoughts.
Sure. So we encourage everyone to take a look at the dashboard. If they have questions, there's an opportunity for people to pose and ask questions about the data there. We hope that people can take a look at this information, and we hope that that information can help them make better decisions. We want to lift the veil of mystery around this virus so that we can see exactly what is happening within the state of Indiana, so that people can follow and feel more comfortable that we are following a rational, effective approach to managing this virus.
We'll be sure to have that website on our website at wishtv.com. Dr. Rennes, thank you for joining us. Some great work you're doing there. We'll be sure to stay in touch, please.
Great.